There's been an outbreak of the dangerous Legionnaires disease. In one of Sydney's busiest areas, 4 men have been diagnosed with a potentially deadly bacterial lung infection after all spending time in the area surrounding Town Hall Station. That's in the centre of the CBD.
Yeah, for more on this, we're joined by Dr. Zach Turner. Good morning, Doc. What can you tell us about this disease?
Good morning, thanks for having me. Look, Legionnaires disease and Legionella bacteria is found all over the place. We find it in lakes and rivers and in soil and dirt as well, so it's found very commonly. But where we see it mostly now is in things like refrigeration units and air conditioning units, which is possibly where this came from, this outbreak came from this time.
And we've seen episodes of this in the past. It can be very, very dangerous, right?
Very dangerous, and it has very high mortality rates for people that catch it if they catch it late. So it is something that we need to be on top of. And if you've got or had any symptoms of a cold or flu, headaches, nausea, vomiting, just the normal cough and cold are the things that are the beginning of Legionnaires disease as well. So we have to get on top of this very, very fast.
Okay, so how does it spread? If you're presenting with cold-like symptoms, most people get a cold, yeah. or a cough. So how does it spread, and how do they know it comes down to Legionnaires disease?
Great question, and this is what makes it so difficult to treat, is because it is and presents exactly like the common cold, and we see it all the time, everywhere. The difference is, though, is that it'll continue to get worse. It's not going to follow those same symptoms. You will get the fever, you will get those aches and pains, but part of this as well is the history. So we have to know, have you been working with fertiliser or soil? Have you been working with refrigeration units or air conditioning units or in spas or saunas?
Okay. There haven't been too many outbreaks in the last 20 years, but it was quite common in sort of the 80s and early 90s, right? Yeah. So what's changed? Partially that water, because it's stored and it grows in kind of warm, tepid, still water, so that's why it's in some lakes, but they're air conditioning units, and so we've got much better systems now that clean through this, and also the droplet protection. So a lot of these, our air conditioning units now prevent actual droplets, and you get this from the droplets. It's not spread through us chatting to each other, though, which is great for containment, but certainly it's difficult, and so anyone who has been in the inner city area the last few days, or the last week or longer,
that's hundreds of thousands of people passing through Town Hall Station. So health authorities have done a terrific job to isolate this in what is perhaps the busiest part of Sydney CBD.
Exactly, and if you're in the at-risk areas, then that's the elderly, immune deficiency or chronic disease, or young children, and you get this, they're the target groups to really get along.
All right, Doc, thanks for joining us this morning.
Cool, thanks so much.
Thank you.